I gotta say, this is one of my most exciting. I've been planning this episode for a long time. Why don't you do it?
We have Leah Houston. Dr. Houston is an emergency physician turned technology entrepreneur who has made it her life's mission to restore privacy and trust to the practice of medicine through the power of decentralized identity. Then you have Bert Worsman. He's a retired board-certified urologist, fellowship trained in an adult pandemic reconstructive urology. He is also the founder and CEO of HealthDrum.com, a platform connecting buyers and sellers of healthcare. So, guys, you're going to have to tell us more.
I am so excited to have you guys on here. You guys are just titans in your own right. You guys are both doctors, both identified huge injustices here in the healthcare field, and you guys are taking a stand. So, who wants to go first?
Well, Leah.
Thanks for volunteering me. Well, thanks for having us on. You know, this is a really important topic, and I appreciate you guys paying attention to it.
Oh, yeah.
We are absolutely excited to have you. This is one we've been planning for a while, and I know Chris really took it under, which I was very proud of him for.
I've been listening to Bert's points and then passing them off as my own to Appeal Smart for going on 2 years now.
Oh yeah.
So I appreciate all that. So all right, so Leah, you've been volunteered. You're an ER doctor. What are some of the problems you identified, and how are you solving them?
Well, we have this system where, you know, we have patients that need care. We have doctors that want to give them care, but there's a bunch of middlemen impeding that process, disrupting the relationship that doctors have with patients. And they're really confusing the general public into thinking that things have to be this way. Without insurance, you can't get health care. Well, that's false because, you know, we've been practicing medicine for thousands of years before the United States even existed, before the insurance markets even existed. So, you know, there's just a false narrative being pushed, and it's time to crack that.
Oh, yeah. And what does your solution look like?
So, what's essentially happened is they've created an environment where it's very hard for me as a doctor to connect with patients and to document things about you and to work and to do my job without interfacing with all of these third-party systems, whether they be insurance companies or employers, large vertically integrated health systems, or even some of these smarter or smaller startups that are essentially, you know, private equity owned organizations that are buying up private practices and then dictating.
There's a lot of those down here.
Yeah. And then what ends up happening is they try to protocolize what we do as doctors and dictate how to practice. And medicine is an art first. We're all scientists. We all had to do all of these, you know, intensive undergraduate science, you know, classes in order to get into medical school. We had to take many exams to pass through medical school, residency. I mean, this is an extensive amount of training, 20,000 plus hours for every doctor in order to just be able to do what we do. So to try to go in and say, okay, everybody with a cough, you have to do this, 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 and this. And everybody who has chest pain, you have to do this, 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 and this, and expect to have good outcomes and expect to make, you know, the independent thinking doctor happy and free to do the right thing for patients. It's just not going to work. So the solution that I've come up with is a decentralized identity solution. And so we're all now in the digital world. We all have different identities out there, social media platforms. Our bank, our financial identity is owned by our bank. Well, in the future, we're going to all have digital identity wallets. And in those wallets, we are going to own all of our digital assets. And those digital assets could be a title to our car, a title to our home. They could also be our degrees, our certifications. So as a doctor, my medical degree, my medical license. As a patient, your health record is your data, is your authentic data. Now, when we have ownership and control over our data and we own and control our wallets, we then can interact in a peer-to-peer fashion and essentially eliminate the need for all of these third parties who are trying to co-opt this relationship that we have. And so we've built a digital identity solution for doctors that will allow them to own and control their professional identity, their professional credentials. And the long-term goal is to allow them to interact directly with patients again through the system.
And then you have a new person that's going to be on the system here with Bert here.
Yeah.
Bert's a little retired. He's suffering for a little bit of retirement right now. But you still practice, right? Now you don't practice, but you still give a lot of healthcare guidance.
A lot of guidance, especially in the prostate cancer arena, where there is just a trove of misinformation, and that's another problem in healthcare. There's a great Stanford professor, John Ioannidis, who looked at the whole healthcare information field and wanted to know if, in general, all or most of healthcare information could be trusted. So he reviewed hundreds and hundreds of medical-related papers, and the bottom line was that most, if not all, published research information was false. Okay, so this is absolutely important, how the healthcare information pool is mostly poisoned because it's filled with biases, assumptions, and founded on junk science instead of proper scientific principles. So this is the pool of healthcare information everybody's drawing on, not only colleagues but consumers, the oversight organizations like the FDA and CDC, healthcare attorneys. Everybody's drawing from this pool of healthcare misinformation, and guidelines come from this pool of misinformation. And because of all these lies going on, it's no wonder the healthcare consumer, the public, is skeptical of guidelines. No wonder.
Mm-hmm.
And this goes into the whole protocolizing situation. How they're building these protocols is through this disinformation that's been pushed. And through technology, it's been amplified.
Right.
Oh, yeah.
As doctors, we used to read these papers. We used to discuss them together. We used to, go to mini conferences in the hospitals. We used to have what was called M&M. Some hospitals still do this, where we talk about the current research, we discuss it, and then with our patients, we together make a decision based on the risks, benefits, and alternatives for that individual person. And this disinformation amplification that he's talking about is really affecting, the whole system. I agree.
Oh, absolutely. And we're not the first ones to challenge this whole insurance-based healthcare system in the U.S. I mean, there have been a huge number of scholars from the Rand Corporation to Clayton Christensen. They've actually identified the flaws in our insurance-based healthcare system. Last year, healthcare spending in this country reached $3.8 trillion.
Wow.
Okay, that's more than the GDP of a lot of countries.
Fifth biggest economy in the world.
Yeah. And
is the U.S.
right.
Or just the global
it goes U.S.,
medical.
China, Japan, Germany, and then the U.S. healthcare system.
Right.
Oh, wow.
Is bigger than every other country's entire economy.
But
and most of that money is just kind of being fizzled off.
Oh, yeah. What's even more stunning is when you look at this number, a third, how many trillion? Over $1 trillion is wasted on administrative services.
Uh-huh.
And the other stunning thing here in this whole insurance-based healthcare system in the U.S. is that the health insurance industry is about the only insurance industry that covers day-to-day and routine costs and services. Your car insurance doesn't cover the cost of a new tire. You pay for that.
I came up with that line.
And
I use it a lot.
And if we could cover a whole lot more folks for catastrophic care, in-hospital care, if people would just pay for their office-based visits.
Exactly.
2/3 of all the healthcare delivered in the U.S. is either office-based or outpatient, and most of it is generally affordable. Okay?
Yep. So me and Bert go back about Silver Lodge about 2 years now.
Yeah.
So him and I are building a just an open source, not open source, but a marketplace for cost transparent care. Because there's things like cosmetic surgeries. There's some things that you can actually see the price for. But
exactly.
most of the time, I go to the doctor. I'm just going to get a bill. I feel like he doesn't even know how much it really costs.
Right,
They're just doing things. So so Health Drum is around specialty care. It's about direct to pay consumers.
Right.
And yeah, that's one of the things that really blew my mind because if you think about it, all that money I spend, especially me, I have a baby, and so that family plan, covering it's a tremendous amount of money, and then to go up, and then you really showed me with our research and actually loading Health Drum with all these services. I'm like, wow, this really is very affordable, and there is no solution. Because one of the things I wanted to talk to you, or one of the things we talked about was, how can we actually bring back this general catastrophic only, if you come down with melanoma or you get hit by a bus, then you talk to insurance companies. Besides that, why are we talking? Why do I have to give my insurance card every time I want to just go?
Exactly.
To get whatever is wrong.
Well, the other travesty here is that the majority of people pay for their routine care anyway. The insurance coverage is a scam because you come in. You pay your copay, you have to meet your deductible, there are non-covered services, and you may have pre-existing. Mm-hmm. So one way or another, the healthcare insurance business is a casino. The house always wins, and you can see they make record profits for shareholders. The insurance company's allegiance is to shareholders before anybody else, and they've been very successful in making money and scaring people. And the worst thing they've done is that they have doctors working in servitude, and this enslavement of physicians by the insurance industry is an absolute travesty.
And that's something you talk about, Leah, like the enslavement of doctors.
I don't say enslavement,
okay,
but I
fine.
do say indentured servitude. Because we pay. My student loans were $360,000 when I stopped. My training. And I've been fortunate enough to pay it off, but I had to work like a resident to do that. And so essentially we are forced to take whatever job we can get, even if that job is essentially forcing us to practice unethical medicine. And unfortunately, that's what's happening.
That's rampant these days, because unethical medicine, because the physicians' overhead these days, because they have to abide by all these insurance-based rules, physicians' overhead is over 70%. So physicians are like gerbils on a treadmill trying to cover costs. So a lot of them are forced into applying all sorts of CPT codes to patients to maximize reimbursement. And the patient sort of gets lost in the process.
Is that what you find?
Yes. And also, large vertically integrated health systems have the right to add on facilities fees.
Yeah.
So a knee replacement, as if I'm an orthopedic surgeon, I might be able to do that for $15,000 to $20,000 as an outpatient in a surgery center. But a hospital is able to charge $50,000. So I'm unable to keep my private practice opened because the hospital is able to charge so much more than I am, and my overhead isn't able to cover the costs of my private practice. And so I'm essentially forced into employment, and I'm forced to give up my private practice and sell my practice to, one of these.
So you're saying you can't charge what the hospital charges, even if you wanted to?
That's part of it. Yes, because the hospital is allowed to tag on these huge facilities fees that are essentially like, oh, we're doing a public service. We take care of the community, so we have to overcharge in order to keep our doors open. So they've made these agreements, and because they're big, they're able to make these agreements. The other issue is, it's called. It's essentially you're not able to open up your own center unless you have permission. It's called a certificate of need laws.
Right.
And so, if you're a radiologist and you want to have your own private practice as a radiology department, you want to have an MRI, a CT scanner, and have your own private center, you're not allowed to. You're not allowed to open it because there's no certificate of need. And who runs the certificate of need programs? The hospital boards. So, of course, they're not going to allow private people to open up.
Absolutely true, because the whole healthcare arena has been mined with healthcare laws, self-serving laws that benefit the insurance company and benefit the hospitals. The insurance companies collude with hospitals all the time for price fixing, yet the FTC doesn't get involved. There's no fair trade scrutiny of this whole healthcare system that Clayton Christensen described as dysfunctional, inefficient, and totally unsustainable. I mean,
to say the least.
He that's written in his book, The Innovator's Prescription. They've detailed all the flaws in our healthcare system. Nobody's paying attention. Taxes are going through the roof to pay for nonsense healthcare.
This is all because of the McCarran-Ferguson Act, which essentially, there's federal regulation of insurance. And so the McCarran-Ferguson Act basically said, we are not going to make health insurance abide by these regulations. So it's a free-for-all.
Yeah. Absolute free-for-all.
So I think about, if you have right now, the pandemic also just made things even worse because in the sense that you have an emergency, your heart, you're feeling these palpitations, you want to go get a doctor, you try to get a doctor's appointment, you're not getting one. What is it? What month are we on? We're on September, you're not getting one until maybe January. Mm-hmm. So then you're forced automatically to go into the ER because there's no other options. They won't take you anywhere else. Sometimes you can't even go into urgent care if that's even available near you. And you go into the ER and then you get a bill just because you wanted to get a checkup, but your doctor's not available. He's not doing telemedicine. Or maybe they're already booked out and they don't have anything for months. You're not going to wait. You're concerned. So you're going to the ER. You go in for a couple tests. You get a bill that's over $1,000 for nothing. Like, oh, everything's great. The doctor walked in for 2 seconds, said something to you, read it from the paper, didn't have a conversation with you, and walks away.
This is why I don't have insurance.
And this is why you're not an ER doctor anymore.
Well, that's a different story. That was an identity theft issue, but
okay.
But not having insurance, that's a bold move. I think these days people just, I'm very holistic. I believe in holistic medicine for most part. I really try to avoid going to the doctor. I go for just more of a panel where I know these days there are other options for probably getting that panel done. And, I think about that and I have medical insurance because I have it through my company.
Yeah, but here's an amazing statistic. That everybody's that has health insurance is overinsured and overpays because 50% of the population consumes only 2% of the healthcare dollars. It's outrageous. These scare tactics and also the chance of a catastrophic event is very, very small. But people think, I could have the next car accident and, I'm going to, and the other thing, not all health plans are equal. There's an extraordinary amount of junk health plans there. The more affordable, the less you get. You get a lot of peanuts. You get yoga, you get a free meal, you get a free ride, but you don't get cardiac surgery.
Yeah.
I'm going to put a little plug in for a couple of organizations that people can look into in order to consider the possibility of getting a private doctor again and of getting catastrophic coverage without having to pay for insurance. So I personally have a health sharing plan. There's many, many health sharing plans. Some of them are religious, some of them aren't. I'm not going to name the one that I use, but all of them charge about half of what current insurance charges, and they only cover catastrophes. And because it's not actually insurance, there's no guarantee. But as we all know, there's no guarantee with the current insurance. They refuse to pay the bills anyway.
Exactly.
They refuse to pay the doctors anyway. So essentially, they have a list of things that are covered. All of the catastrophes are covered on my plan. And then I have a DPC doctor. I have a direct primary care doctor. And that person, I pay a monthly fee, $75 a month. And I almost never have to talk to them. But when I have a problem, I text them and they get back to me. And I'm not worried anymore. And in the case of, chest pain or whatever, things like that, they could say, come into my office in the morning based on the history. And they could say, come for another, visit tomorrow and we'll check on you and we can get the labs and things like that. Where if you go into an urgent care, you don't know if you're going to see the same person the next day. And so it makes it impossible to actually properly care for people. Medicine is about a relationship between a doctor and a patient, and that relationship is what's been disrupted.
The other big problem with the insurance-based industry is that it has absolutely stripped healthcare decision-making from the consumer, the patient, and also from the physician. Physicians can't even order a test or a treatment without calling the health plan and having to talk to some non-medical intermediary and get an approval. All these barriers that the insurance industry puts in place are designed to stop spending money on healthcare and so that they can keep the profits.
And that's what you were saying about where the $1 trillion, the third of the overall spending, is being spent on all this extra stuff.
Garbage.
It's just that phone call that has to happen.
Right.
With people making probably decent money, like two people on the conversation having this call, and that's where those hiccups are coming from.
Yeah, and a lot of the consumers or the public, they have no clue as to how the insurance companies screw physicians, how they play these games with changing the codes, making sure that all the codes are on their claims filing business. Then they lose these claims. There's tons of games going on there. Then they downcode them. Then they want to see the records. Then they want a clawback, which they can do up to 18 months. So there's
How do you keep a practice open like that?
endless games.
And I've seen that a lot with the dental industry.
Right.
They're the easiest ones to pickpocket.
You have to have the personnel to respond.
I call them uncompensated administrative burdens. They put these uncompensated burdens on these private offices, and you no longer can survive with the one, admin. You have to hire 10 people to respond to these requests, and that costs money. It's a theft of services. What other industry can you get the services and not have to pay for them and then wonder if you're going to be paid for the services that you've rendered? It's an outrageous situation. It's pushing good doctors away from practicing medicine. It's causing extreme burnout. This is National Suicide Awareness Month, so I want to bring this up. The physician suicide rate is higher than any other profession. We used to hear about postal workers. Yeah. We used to hear about dentists. Now it's physicians. Doctors are killing themselves at the highest rate of any profession. They're choosing to die by suicide rather than to continue this moral injury that they're being forced to do just to be able to keep their head above water. This is a very serious problem. It's
insanity. And how people can justify health care for all when it means that they're justifying enslavement of physicians, because the physicians are being totally exploited. Their professionalism and their knowledge is totally exploited by these health insurance companies. They're making the money.
And I feel that on our side, we feel it in the sense that, I keep going back to my example because I struggle with this often. I remember I went to a doctor, this was a couple years ago, and, it was a recommended doctor. And when I went and I started saying, hey, I decided to become vegan, I suffer from migraines. A year into becoming vegan, I realized that my migraines had gotten better, which I've had since I was 12, where I lose my vision, my lips go numb. It's very serious. I've tried so many different things. But by the way, becoming vegan has helped. And his reaction was yeah, I don't think so. And I just felt constantly insulted. And I'm like, well, this is not an experience catered to me, and I'm spending so much money. What happened? I stopped going to the doctor because I was still paying the money because you need to have it for an emergency is what we're told, right? So the money is sitting there. I'm paying this. I don't go to the doctor because I completely disagree with the beliefs of the experiences that I've had. If I'm telling you it's working, why don't we sit down and have a discussion? What other changes do I need to make in my life? I don't believe that it's catered to us either. We're just we're being lumped into what can you pay, and you all go under that section. It's not catered to a real experience. You can't have a real conversation with a doctor. It's really tough. So you're hindering yourself, as well as just this money is being wasted because it's just sitting there in case you have an emergency, which you don't even know what possible emergency that could be.
Again, it's about the personal relationship, and I'm really sorry that you had that experience, because it's not indicative of the way most physicians practice medicine. Most physicians want to take that extra 5, 10, 15 minutes and really dig into what's going on. The problem is, when you're employed, you're being forced to hurry up and churn as many patients out as possible. And if you don't meet your quota, you're going to be fired. So when you use your insurance, you're essentially choosing to work with physicians who are going to rush you. And it's very rare that anybody can survive in private practice taking insurance in that kind of environment, because of all of this uncompensated administrative burden that Dr. Vortman has talked about. So, in my opinion, the answer is find a private physician.
Yeah, I want the unfiltered advice of a doctor.
Yeah.
I want to know the knowledge that you bring to the table without it being filtered through all these layers of different things, of whether it's the insurance, of whatever. I want it to just be your unfiltered, hey, by the way, you can go do these panels over here. You can order this and do this however often you want. Why don't you try this other experimental? I want to know what those options are. And I feel like you get like the public, just like with the social media thing, the one that everyone is talking about. Oh, go do this, take that. And it just becomes like, I just think about like healthcare these days, and I'm like, that's just such old news. It's like, it's so antiquated.
I want to know how we really get the good information, because I understand that he's like, okay, going vegan, that probably didn't do it. Although to me, removing something from your diet, that's got to do a multitude of things. So it's like, I don't know how you even justify that. But there's a lot of stuff out there. There's a lot of crap out there. Most
of it is misinformation.
So you're even pointing out that even the medical studies are coming out that are not only crap themselves, but then based on crap.
Yeah.
Then how do we get the right information? Are we really diluting? Are we diluting lemon juice in water to get these things?
Where do we begin to find the right choices?
I would tell folks it's extraordinarily difficult to find truthful sources in healthcare, because most of it is based on junk science, and everybody draws from that well. And once misinformation is published, it's in the system, because social media and media perpetuate misinformation. Mm-hmm. I mean, you only have to see what's going on now on social media with this COVID stuff. But it's been going on for years. But it's just getting worse with media.
So this is why I've built our solution that allows physicians to have a digital identity that is theirs. It's decentralized, owned by them. They have their own secure enclave. And with that digital identity, they can interact with their colleagues. When you have your credentials checked and you have, for example, a license in the state of Florida to practice medicine, you're automatically entered into a group of other licensed physicians in the state of Florida, where you can discuss and collaborate on these types of issues. Right now, there's what's going on other social media platforms that physicians are a part of, or even within their own health systems that they're working in, is the vortex of silence. If you have a dissenting opinion, or you want to discuss a potential therapy, something that you've noticed, on a case-by-case basis with your patients that isn't in line with the current way of thinking, you're essentially silenced.
I see it. I totally see it. I mean, first of all, I've had a lawyer review a document that I'm a designer. I've worked in Photoshop, and I looked at this signature. I'm like, look, it's pixelated. That's not a wet signature. They photoshopped that on there. But even the forensic lawyer could not say that's fake because of what it would mean. And then we talked about, what's her name, Elizabeth Holmes. She claimed that she claimed that with this tiny little bit of capillary blood that she can run all these tests, and all these doctors were like, What?
I have to tell you, I was in Silicon Valley when she was doing her initial raise, and that opportunity came across my desk. They asked, "Oh, what do you think about this?" I said, I have a background in molecular biology and biochemistry, and if she's not even able to point to one piece of research that kind of gives us an idea as to how she's coming about this, then it's BS.
But at the same time, but like you said that behind closed doors, but a lot of people were thinking that, but everyone else was kind of, all the other physicians that were like kind of not in charge of actually calling bullshit on this. Like they none of them were like, they're like, all right, well, let's just see the research.
I don't believe that
instead
any
of,
doctor thought that was real.
I agree, but they
not
thought
possible.
that, but there's not some system, like no one wanted to be no one wanted to be wrong and put themselves out there.
All of that's true, but the converse is true also, where the history of medicine has recorded numerous examples of treatments that were mainstream before somebody woke up and stopped the nonsense. Prefrontal lobotomy is one of them. There's a whole.
I can't believe that was a thing.
There's a whole slew of those procedures if you dig around in the history of medicine, and it's amazing. So you have the problem here of herd mentality, also a big problem.
Mm-hmm. But I think that's what the point I was trying to get to is that everyone just kind of wants to go with it, and we don't have this open and honest system where we can like be wrong, because I feel like no one, it's like punishable to be wrong. So do you think on your platform people are talking to each other that you're going to create this culture of say what you're thinking and really like take the filter off?
I do, because we actually spent some time with an MIT mathematician to build out a token economic structure to incentivize truth. And so it's a self-moderated forum where the community moderates itself. And so if somebody says something that they think is wrong or should be flagged, they can flag it. But essentially, it's a group of people that decide whether or not. It's not just one person at the top who decides what's going to be shut on and off. It's not one algorithm that's been designed that's going to decide which bots are going to turn things off. So we're going to give it a try. We're going to test it. We're going to see how it works. I believe in the physician community. I believe, all of us really went into this to help people. We, spent our youth with our nose in a book because we wanted to learn how to heal people and prevent them from, death and permanent disability. And most of us are devastated that we're not able to do that in this current system. And so I think that we're really motivated to make changes and to adopt the new systems and to build the new systems that really bring us back to our patients.
Absolutely. In the 40 years that I've been in healthcare, the evolution has been just degradation of healthcare. The cost of healthcare is just skyrocketing each year. There are no brakes. We know what brakes should be put on. Nobody has the guts to do it. There are no market forces in healthcare, okay, because pricing is all controlled by the insurance industry.
I want to be careful, though, because I do think there are a lot of people with the guts to do something and say something.
Mm-hmm.
The problem is they're not being listened to.
Right.
For example, we talk about the price of healthcare. We talk about the cost of healthcare. We talk about the collusion between insurance companies and health systems. Most people don't know about, for example, pharmacy benefit managers.
Right.
Pharmacy benefit
Big
managers,
problem.
They're the ones that decide what medications are going to be on the formularies for insurance companies and hospitals. And, so for example, CVS Caremark is a pharmacy benefit manager. So think about this. We have a front-facing, consumer-facing CVS that just looks like it's a pharmacy, but they're deciding what your insurance is paying for and what they're going to pay
There's
for.
huge financial conflicts of interest in healthcare, and most of it on the side of the health insurance industry and all the hangers-on that feed off that trough of healthcare dollars. The fact that we don't have cost transparency and we just have surprise bills and we have no market forces, no wonder the cost of care keeps spiraling up. There's only 3 arenas in healthcare that see market forces and have seen stabilization of care and costs, and that's the cosmetic side of it, the weight loss, and the infertility. Why? Because these three arenas are usually not under the stranglehold of the health insurance industry.
But they're also exuberantly expensive too. Like, we're not going to get into that, are we? Like, we want to make sure that, like, how are we gonna legitimately pull the? Because I feel like there is a finite cost of what it actually costs, and how are we going to actually bring that down?
Well,
In my opinion, transparency is the answer. We need complete.
Oh, did you hear that, Bert?
Absolute transparency.
I don't want to cut you off.
Absolutely agree.
From the beginning to the end.
Exactly.
From the manufacturer that makes the medication, the manufacturer that makes that device, that stent that you're going to get in your heart, to the insurance formularies, what's being paid for what, to what hospitals are getting, to what hospitals are charging, to what you're paying as a consumer for that procedure. We need absolute multi-directional transparency, and that is the only way that this is going to be fixed. Unfortunately, the price transparency rules that were put into effect by the last administration were shut down by this administration. And so without getting political, that was a big problem because why do they not want us to know the real prices of things?
I remember that when he did that. I was like, oh, that's a good one.
It was a good one.
The big problem is you have to drill down to the money, and the insurance industry is making all the money. They have all the lobbyists. They have all the power. And vote-seeking lawmakers are not interested in doing the right thing. They're only interested in getting votes and being there on the next round.
For those of you who want to understand this a little more, go to opensecrets.org, and you can see who's paying who for what. You can see what organizations are giving to what politicians and things of that nature and how they're voting. And I mean, it takes some digging, but you can get a little bit of an understanding.
So one of the huge problems in the healthcare arena for physicians, too, is that the AMA has pretty much thrown physicians under the bus. And, with all these problems and the domination of healthcare by the insurance industry, I mean, they are your doctor. Your real doctor is not your doctor. The real doctor is the health insurance industry. None of our boards or organizations, societies have really done anything to get in the way of this domination and protect the physicians from this assault, this enslavement of the profession. There's no other profession that has been so enslaved for everybody's needs as the health insurance, as the physicians have.
So, Bert and Leah, who are the disruptors that we need to know about? Where do we begin to say, do people want to get educated on this? Do they need? Is there a source where they can find out how much they're paying for in insurance in comparison? Like, where do people look for the information they need to be looking for when you're just going on Google and you're just lost and you can't figure it out?
Well, it's really difficult because there's an act called the 21st Century Cures Act that is really trying to push for transparency around your healthcare data. And that was finalized in November of 2020, so fairly recently. So I think that if people start paying attention to that, they're going to, and they really push for their records to be actually given to them. Give me my records. Give me all of my records. What did I pay for? And demand it. The people have to demand it. As far as where can we compare prices of insurance, I mean, that doesn't exist yet. It doesn't exist because they don't have any incentive to share that with people. But what I can say is if you want to unplug from those systems, you can look into health sharing plans for your catastrophic coverage. You can go to the DPC Alliance, Direct Primary Care Alliance, and the DPC Mapper, Direct Primary Care Mapper, and look for a direct primary care doctor near you. Go on to dpcaction.com, sign up to learn more about what they're doing. Go on to the Free to Care website, freetocarehealthcare.com, and see what they're doing. Look at their white paper. Understand what, there are doctors out there who really do want patients to be freed from these systems, and they want to have a relationship with their patients again. So, I think this is just the beginning. If you're a physician, sign up for HPEC. Go to hpec.io and get your digital identity. You know, we're going to be sending out invitations over the next few months. We're going into production this week. And, you know, just, you know, educate yourself. There's a lot of stuff out there, but just remember, you know, just like you want to have a plumber that you have a relationship with, that if your sink is leaking, you can call the person and know that they're going to show up and know that they're not going to overcharge you and know that they're going to give you, you know, a fair rate. You want a doctor that does the same thing, somebody that you can call and have a relationship with that you know is going to be there for you. Yeah. And the insurance system is essentially trying to confuse you into thinking that insurance is the one that provides care. And you just go to this health system, or we cover in these areas, and it doesn't matter who you see, just as long as you use our insurance to see them.
As long as they're in our network.
Exactly.
Right. Well, that's why we created the platform Health Drum, to connect buyers of healthcare services with sellers of healthcare services. And physicians can log on, they can post their prices with us, and we can market it for them. And there's a great need for cash price healthcare. I mean, there are something like 50 million gig workers in this country. Most of them don't get health benefits. There are a lot of people that don't want to pay exorbitant fees for health benefits or so-called affordable care and get peanuts, you know, because most of these so-called affordable plans are absolute junk health plans that don't cover anything meaningful except yoga classes or free doctor's visits, you know.
And I would also be careful about free doctor's visits. Are you actually seeing a doctor, or are you seeing a non-physician practitioner, like a nurse practitioner or a physician's assistant? You know, these individuals are highly knowledgeable, but, you know, you really want a physician, at least a part of your care, overseeing your care, available should they not know, because they didn't go through the training that a doctor did.
I really liked the decentralized option of your records, because I think about my history. I have copies, like physical copies of some of the record history that I had through my life growing up, and I was able to just digitize that and like scan it and put it up on the cloud. This was not that long ago, and I was shocked. I'm like, how do I not have access to this? Why can't I find the doctor that did my procedure X year at this? Why don't we have access, just like we have our wallet with our IDs in it? Why don't I have access to my own medical records?
I know.
Why can't I just have a conversation with Leah and say, like, hey, by the way, like, here are my records. Like, why can't I just do that with anyone?
You know, I'm not a fan of, like, you know, government healthcare and this and that, but you know, the fact that we let private industry take over medical records is just ridiculous, because, you know, from a developer standpoint, none of these systems talk to each other. You all need you need special API integrations written to do all this. And, you know, and like, you know, and we've reaped some of the benefits. Like Boca has ModMed, you know, they raised almost $1 billion up there in Boca, and they're essentially an EMR company. And it's like, really? Right. Like, we can't just all be using the same thing.
Exactly.
I mean, I worked for a medical staffing company, and we would always, one of our big like, you know, ways to make money was like, we would backfill your hospital's staff. Well, they go out and got trained on Epic or Mars or whatever the ones they are, just to go to a new hospital, and you got to get retrained again. And that causes that problem that now that your all your medical records are spread all across this like these different serverless clouds from all these different private companies, we don't have any access to them.
It was more than that, because not only was it just an absolute hodgepodge of stuff that didn't talk to each other or the hospitals, but physicians had to spend an extraordinary amount of time of their day, non-patient care time, to input data.
We become data entry clerks. But I do want to mention the 21st Century Cures Act once more. If you look at item 4003 and 4004, they are enforcing interoperability on these EHR systems, and they're going to penalize any system that blocks information from patients. So every patient out there who's frustrated that your information is trapped in one of these EHRs in your local hospital, you can demand your records, and they're required by law now to give them to you. Unfortunately, there's no truly interoperable way yet. But the fact that this law was finalized in November, now it's up to us. It's up to we the people to put pressure on these systems to make it happen and to comply with this regulation. And so, I believe that regulation in and of itself, if we push for that to be actually adopted as intended, then we can move the needle on this.
Book and verse there. I like it.
Yeah, I'm also very much not only helping the consumer and the physician, but we need to be geared to helping the employers in this country, because there's absolutely no need why they should be saddled with these fraudulent insurance costs to provide some...
We're the land of the free, but our health care is based on your employer.
Right.
That's two opposite things. All right, so we are getting to the top of the hour. I think we can skip the word from our sponsor, the Google Sheet. I think everyone knows what the Google Sheet is by now. But let's just kind of recap. So we got Bert Vorsman here with HealthDrum, Leah Houston here with HPEC. You guys are both solving problems. What's like one final word you can give to the listeners? Maybe a call to action, or Leah.
You are not controlled. I know it feels like you are. I know it feels like your data is captured and controlled. I know it feels like you have no say, you have no rights. But if you look out there, if you listen to radio stations like this, if you search for organizations like HealthDrum and HPEC, you will find answers that will surprise you.
I would agree. I would say, hey, you take control of your health care and don't let the insurance industry bully you and overcharge you.
Awesome. All right, so we got a bunch of notes over here. We get a bunch of great resources out of Leah here, and then Bert's always available. info@healthdrum.com if you have any questions for Bert, especially anything in the prostate arena.
Hello.
Hello. It's hello, not info. I set it up. I should have known.
Yeah.
But yeah, guys, hey, listen, like I said, I've been looking forward to this episode for a long time here. I think this is some of the most quality content that we can possibly produce. So yeah, guys, thank you.
It definitely got my wheels turning a little bit, and I definitely want to have some side conversations on this, because I think also the underserved community doesn't understand. And I try to also be a voice to explain that. So whatever I learn, I teach my family.
Right.
A ton of other Cubans that don't understand English perfectly and are trying to figure it out. And they're the ones spending more money.
See,
I make more money and they're spending more money.
Right.
And it's insane. And so I always try to understand it from my perspective. Young people care less. And it's so true. The older guys are just like, no, my mom believes everything the doctor says. And sometimes I'm like, Mom, that's not, and I'm like, that's not true. You listen to it, you just know. And I get so upset just thinking about that.
Well, right now, everybody's drowning in health insurance propaganda.
Yeah. Well, we're here to
Not
hopefully
anymore.
push that noise out and just educate you guys. But this brings us to the end of the episode. Thanks again, both of you, for being here. We really appreciate you guys, sharing your insights and educating us. As always, thanks for listening to the Infinite Attraction podcast. If you enjoy the show, please rate and review us on Apple Podcasts, and be sure to come back next week. We're live Tuesdays
on Jolt Radio
at 10 a.m. And until then, you can listen to us also any episode, Spotify, Apple, Google, and follow us on Twitter at the IA Pod, Instagram, it's Infinite Attraction Podcast, and stay tuned for some exciting new posts. See you guys soon.
Thanks, everyone.
Thank you.
Yeah.